Good morning. I'm Abby Drain, President and CEO of Seven County Services and Bellwood and Brooklawn. I want to welcome you here to Seven County Services Child and Family Office here on 22nd and Broadway. At Seven County Services, our purpose is to boldly provide quality care and health services to improve the lives of individuals and families throughout our region. I'm here today to announce that Seven County Services is receiving funding from the Substance Abuse and Mental Health Services Administration. It's a federal program, and it will provide critical and much-needed crisis response services to Metro Louisville and surrounding communities. Each of you are aware of the devastating impact of COVID-19 on our community, also the racial unrest and the increased level of violence in our community. We are living each day with those consequences. I think about our clients that we serve and the work that they're trying to do in recovery every day. It reminds me of our friend Jimmy, who was doing really well in recovery before the pandemic hit. And then the pandemic created additional isolation and a loss of a job and separation from his family. And he lost that battle with recovery. Substance abuse is a silent pandemic inside of our larger pandemic of COVID-19. And Kentucky ranks comparatively higher than other states in rates of adults with mental illness and substance use disorders, and suicidal ideation, and equally low in terms of access to care for those individuals. Kentucky has seen nearly a 50% increase in overdoses here among our adults, but equally as devastating is the 90% increase in youth overdoses in our community. And as we look and dig deeper into the numbers, we know that disparities increase across our racially diverse groups. As our community goes forward, we can and must do better. A 2-year, $5 million grant from SAMHSA will enable 7 counties to enhance our community services here, our trauma-informed care, and our health crisis response system. Through this grant, we plan to expand crisis care, mental health screenings, telehealth services, addiction services to enhance our response to the opioid epidemic, and integrated services to vulnerable populations such as the severely mentally ill. In addition, we'll expand telehealth services, and expanding those services will help us decrease hospitalizations, increase access to care, and provide our clients with community-based treatment and support. 7 County Services is in every corner of our communities in 7 County area with 30 locations. Our incredibly dedicated team has been on the front lines with our community and with every obstacle that we've faced in our community. These funds will help us scale up to continue the critical frontline work in our communities and something that they desperately need right now. However, we're not alone in this work. We're here and we care. Now I'd like to take this opportunity to introduce Louisville's Mayor Greg Fisher. Mayor Fisher, thank you for being with us today, and we know that it's through our collaboration that we'll help improve our communities.
Thank you, Abby, and good morning to everybody. This is a wonderful announcement here today that will really help our community. I want to recognize Dana Mayton here from Congressman Yarmouth's office. I call him the best congressman in the country, and Dana, please give our thanks to the congressman and to you guys for the tremendous work that you do here in our community with the help of this federal grant. It's been a heartbreaking week here for our community. This has happened too many times. On Wednesday, an act of gun violence took a young person from his friends in our family here in Louisville, really just blocks away from here. It happened at a school bus stop, a stop that most of us think about when we have kids and grandkids or at these stops, that we expect it to be a safe place and a sacred space for kids to gather before they go off to school. And that made it all the more shocking when that took place. So we still hold the ties family in our hearts, and our city continues to work with our number one priority, which is to build as safe as community as possible, focusing on certainly whole of government approach, but a whole of city approach. In a healthy city and a healthy democracy depends on each and every person to say, what can I do? You can't just look at somebody else and expect them to take care of everything. You just can't look to the government. You just can't look to the nonprofit sector. You have to say, we're all in this together. And I'm gratified that a lot of people have really stepped up to ask what they can do. From a government standpoint, we quadrupled our funding for programs aligned with this whole of government and whole of city approach. Want to thank the Metro Council for approving this budget. It's unprecedented, this type of funding that we have, and it includes a needed expansion of our Pivot to Peace initiative, programs through our Office for Youth Development to reach vulnerable youth, and the Reimage program, which offers support to young people who've been involved in the criminal justice system. Just last night, we saw the Office for Safe and Healthy Neighborhood in action at Moore Temple Church of Christ, just blocks away from here on Broadway, where the community came together with grief counselors, trauma counselors for people that were impacted by Wednesday's event and other events of trauma as well. So it was very impactful and important that that type of funding and availability of counselors and therapists is here in our community. There's more as well. A nurse triage program through the Office for Resilience and Community Services is helping keep households stable in these challenging times that Abby referred to. And SummerWorks, it helps young people learn on-the-job skills that lead to careers and lives. And these are necessary because too often people look to the police to solve everything. And look, police are just one part of a public safety system. They cannot and they should not be expected to do every job. One of those jobs that sometimes people expect police to do is to be a mental health counselor. And people don't know who to call. They call the police. They're in the middle of crisis. And frankly, our police officers shouldn't be expected to be mental health counselors. It's hard enough being a law enforcement official. But it happens because, sadly, people don't sometimes know who to turn to when their life is in crisis. And that speaks to a major societal priority and a funding priority where people should know immediately, I can call 7 counties. I can call this number because of the prevalence of services in our community that wherever you turn, you know that there's services available. But from our federal government to state government to city government on down, those type of funds have not been available. And that's why I'm really grateful to be here today with Abby and the 7 counties team to help announce this major grant from the Federal Substance Abuse and Mental Health Services Administration. I know this is most of the 7 counties team here, but I have not heard a round of applause yet for a $5 million grant, and that is not insignificant. So let's whoop it up a little bit here. I mean, we know it's a drop in the bucket, as Abby said, but it's a big drop, and it's better than a stick in the eye. Okay, so we really appreciate this, and what we hope people see is they see results from grants like this, to say there needs to be more of this, and they need to talk to our elected officials to make sure that this becomes a priority for us as a society. So I want to thank our federal partners for providing this much needed support for our community. And this grant, what it does is it helps ensure that people with the best skills and the best training are helping people who need mental health and substance use disorder services. And as Abby said, unfortunately, this is growing in our community. And that would be one of my messages to everybody. If you feel like you need help, ask for help. It's a normal thing to do, to have a mental health challenge, anxiety, depression. If you see yourself going to alcohol or drugs, that happens a lot. You're not alone. There are people to help you live a productive and healthy life. So please reach out. And we have long understood that the needs were great, and we have seen the tragic harm caused by our society's, frankly, very inadequate support for mental health and substance use disorder services. Whether it's the heartbreaking rise in suicides during the COVID-19 pandemic, the unacceptable increase in gun violence, or the needs of our residents experiencing homelessness. And while our Office for Safe and Healthy Neighborhoods and Louisville Metro Public Health and Wellness Team and others within Metro work to support mental health and substance use disorder initiative, it clearly demands a lot more. It demands a community-wide effort and amazing partners like 7 counties. 7 counties has a long history of helping thousands and tens of thousands of people in our community, and that's why I'm very excited to see them receive this grant that they will deploy with efficiency and quality for the citizens in this Metro Louisville region. So Abby and the team, thank you guys very much. We appreciate your good work each and every day and look forward to helping even more people. Congratulations.
Thank you, Mayor Fisher. And we ask, what can we do as a community? What can we do as neighbors? Please reach out. Reach out to your neighbors, watch for your family members, and help them get the services they need. We're here to serve, and we want to help our community. Thank you. Now, are there any questions from the press?
You say you could have possibly 1,000 more people as a result of this grant. How will you go about that?
Yes. Well, we're already spread across our communities in 30 locations, and what this will help us do is hire additional staff to increase that outreach and touch those people in need. The pandemic has hurt our community. It's also put great stress on the mental health services here in this area and across our nation.
You mentioned a startling statistic, talking about the number of suicides. Could you break that down during the period of the pandemic? It rose that high?
Yeah, through the pandemic and through that isolation and disconnected from family members and your normal having connections within your workplace, people have been isolated. They may have been in recovery for some period of time, and this disconnected people. We do have virtual services, but we try to get face-to-face with people that are in the most crisis services. So we have seen a 50% increase in the number of overdoses. We know that Kentucky was the epicenter of the opioid pandemic years ago, along with Ohio and West Virginia. And we are still dealing with that epidemic, that crisis, and that impact on Kentuckians across our state. And what we've done is help people get in recovery, but with this pandemic, it has separated people and isolated more people and increased those overdoses. It's something, as they've lost jobs and lost connection with maybe workers and coworkers and their family members, that has put more stress on them, and they've gone back to the only thing they know, and that would be drugs.
You mentioned that suicides have gone up as well.
Yes, suicides have gone up as well. And sometimes those are connected with our substance use disorders, but the depression and anxiety that's gone along with the pandemic has pushed up the number of suicides and suicidal ideations. Well, thank you. Thank you for being here and supporting us and supporting our community.